I'm a psychiatrist and I want to ask you a question. Do you drink? How do you understand that question? Does it mean that I'm asking if you drink alcohol? Because we know that CDC has stipulated that a man can drink 2 bottles of beer per sitting, a woman can drink 1 bottle of beer per sitting. That's the normal daily limit. So did you hear that? Or did you hear, do you have a problem drinking? This is a very common question in the doctor's room. If you go to a physician, if you go to a diabetologist, if you go to a surgeon, this is a very common question. And we use it to determine certain risks that are associated with alcohol use. And a lot of patients would say, no, I don't drink. But the question they're answering is, do you have a drinking problem? If a doctor wants to determine that you have a drinking problem, there's a screening tool that we often use. It has 4 letters. It's called CAGE. So CAGE is, do you feel the need to cut down? That's the C. Do you feel annoyed when you drink alcohol? That's the A. G is, do you feel guilty when you drink alcohol? And E is, do you need to drink alcohol the first thing in the morning? An eye opener. The other system that we can use for screening to determine whether you have an alcohol problem is called RAPS-4. So R is for remorse, meaning do you feel guilty when you drink alcohol? A is for amnesia. Do you find yourself forgetting what you said, what you did when you were drinking alcohol? P is for perform. Do you find it difficult to perform the things that you expected to perform when you're drinking alcohol or when you're under the influence of alcohol? And S is starter. Do you find yourself that you have to drink alcohol before you get on with your day? So these 2 questions are very separate. If a doctor is asking you directly that do you drink, they want to establish whether or not you drink alcohol, not if you have a problem. So do you drink alcohol? When a doctor asks you that, it's very direct, yes or no. Maybe you drank alcohol 2 years ago, maybe you drank alcohol 5 years ago, or you drink it once in a while. That means the answer is yes, you drink alcohol. Then the following question, the follow-up question is, do you have a problem with alcohol use? And then they will now use the screening tools. So when you go to the doctor and the doctor asks you, do you drink alcohol? It's not judging your alcohol drinking behavior. It's just to establish your alcohol use and if there is any risk that it is posing to the illness that has brought you to the doctor.